This is the Fix Your Sciatica podcast.
And welcome back. So last week I gave you a homework assignment to create your what is called a movement index. Now, if you missed last week's episode, I'm actually going to have you pause and go to the other episode. I'm actually going to be putting that episode into the show notes today. So you mapped out your green, neutral, and red zones. And so today we're going to be taking that data and finally figure out what it actually means and what to do about it. And so in healthcare, we actually love patterns. So if you've ever had an ACL repair, a discectomy, or a knee replacement, or other surgeries, what's going to be most likely happening when it comes to your rehab is that you're going to be handed a surgical protocol, which is a literal recipe where you're going to be following step 1, step 2, step 3. And it's going to be pretty standardized because with these surgical protocols, they are backed by research and they have to be standardized because the surgeries themselves are standardized. But in the pain management world, there really isn't a recipe in regards to you need to do X, Y, and Z. It really is more of a mystery novel. So we actually have to act as pain detectives to find the specific movements that truly unlock your relief. And so in order to do this right, we have to be scientists. And so when you're testing a movement, you have to test one variable at a time. And if you try 3 different stretches, a new supplement, and a heating pad all at once, you're going to feel better. But we might not necessarily know why. And as a result, it creates lack of clarity. And in truth, when it comes to pain management, we need to have a clear picture. And so the goal here is to find what we call your directional preference. And this concept was actually popularized by the physical therapist Robin McKenzie. In the PT world, the medical world, and what you've probably seen in the sciatica world, people often think that McKenzie or the McKenzie exercises are just back extensions or cobra stretches. While those do help a lot of people, they aren't for everyone, and we need to find your specific direction. So what I'm going to have you do is I'm going to have you pull up your list and look at your 3 columns and look at them from last week and try to identify if you fit into one or a combo of these 4 biases. Number 1, if you feel better standing, laying down, but sitting is painful, you're most likely dealing with what is called an extension bias. I call it the stander, the archetype. Your low back actually prefers to be arched, maybe neutral, but preferably more arched than flexed. And so the strategy in this scenario is that we should be introducing more extension-based movements like back bends, cobras, or prone press-ups, a lot of what people often associate Robin McKenzie with. When it comes to daily life practices, to facilitate more back extension, this is where you're going to be adding a lumbar roll to your office chair, trying to limit longer bouts of sitting. And the reason why I talk mostly about sitting is because often this extension bias occurs in people who spend the majority of their day sitting in a chair. However, if sitting or curling into what is called the fetal position actually feels more of a relief, and standing and walking is actually more painful, you might be dealing with what is called a flexion bias, which I like to call the sitter. And this is a scenario where your spine actually prefers to be slightly rounded. So the strategy in exercise selection would be focusing on stuff like knees to chest, double knees to chest, and pelvic tilts, adding flexion into the spine. And that means that from a daily life standpoint, we need to modify your standing posture and walking patterns as well. I see this often in people who, in pregnant women, the postpartum phase, and then also athletes who play stuff like football, rugby, soccer players, or even those power lifters whose hip flexors and low back muscles are super strong and they have a tendency to be more arched. The next 2 archetypes I'm talking about are not necessarily identified very often, but they are pretty common. And so if you find relief only laying on one specific side, or if you look in the mirror, your shoulders are shifted to one side, this is what I like to call the lateral bias or the shifter. The strategy in this scenario, we need to correct this shift. So if your shoulders are shifted over to the right in relation to your hips, we need to focus on bringing them back to the left to center them over your legs and your hips. And so from a daily life standpoint, this is where it's important to identify if you're working in an asymmetrical job. Say if you're an airline pilot and you have to go over a specific area to manage your controls, or you are turning to one specific area. Also from a sports standpoint, we're looking at hockey players. Anyone is going to be one-sided dominant, especially even tennis players as well. And then the fourth archetype is going to be when you find relief when twisted in one direction versus the other. You may have what is called a rotational bias or the twister archetype. And so the strategy in this scenario is that you want to be able to rotate your torso in the direction of relief and minimize rotation in the opposite direction. So from a daily life standpoint, this is going to be, again, huge for sports like hockey, golf, even soccer players who have a dominant side. And as a former collegiate swimmer myself, I see this in other swimmers who have a heavy tendency to breathe just to one side when they're swimming freestyle. But there are two other areas that often get overlooked when it comes to trying to find and identify the pattern during sciatica pain issues, and that includes core stability and the hips. Most gurus are actually going to just tell you to strengthen your core to fix your back pain, to fix your sciatica. But when you're in active state of pain, the truth is that position and movement in the direction that works for you is going to be core strength every single time. However, if you feel pain more so with any movement, but position feels okay, we might be dealing with what is called a stability issue. And this isn't about core weakness, it's really more about control. An example, when you're squatting, you're hinging, or you're walking, your spine should actually stay stable while your hip joints are doing the work of moving and generating the muscle force. If your spine is changing shape during a simple squat, that lack of control can be a culprit. And an example would be like if you're squatting, you're trying to arch too much, or you're squatting and then you round at your back. So we have to look at that. And then finally, we have to look at the further down the chain into your hips. If you're testing all of your spinal motions, bending forward, backward, side to side, and twisting, and nothing changes your symptoms, then your hips are the primary suspect. Which is why I like to use the piriformis test. So the big question is, can you cross one leg over the other comfortably and vice versa? If not, the piriformis on the effective side might actually be shortened. And with a shortened piriformis, it would make more sense to actually stretch that muscle out with a pigeon stretch or rolling that out or massaging it, rather than doing stuff like bridges and clamshells, which can actually shorten those muscles even more. But if your glute feels tight, but you can cross your legs easily, then that muscle might actually be too loose or overstretched or disconnected from your pelvis control. Tightness, as I said in multiple podcasts, is primarily a sensation and not a true restriction. So being able to see, are you able to get into that range of motion or out? And if this is the case, if you have an overstretched piriformis, stretching is not warranted. But things like clamshells and bridges might be more appropriate to you because we want to shorten and engage and coordinate those muscles. So your homework for tonight or for this week is that I want you to go back to your list. You're going to pick one movement that emulates the direction that your body prefers, the direction or movement that makes you feel better. Implement it and see if the pain actually improves. You're then going to audit your current exercise or stretching routine. If you have a list of 10 different stretches that you're doing, you want to check those exercises against your actual pattern. If you have an extension bias, but you notice that you're doing more of a knees to chest or flexion types exercise, you might be accidentally fueling your irritation. The more data you have, the better. And remember, you don't have to solve this puzzle alone. You can always reach out if you're struggling to find your pattern of recovery. Next week, we're going to be pulling back the curtain on the business of healthcare and how the system is built that might actually cause, I'm going to rephrase that. We're going to be pulling back the curtain on the business of healthcare and how the way that the system is built may be getting in the way of your recovery. So stay tuned. If you have any issues, you can always reach out to me at info@ifixyoursciatica.com.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.